Okay.
Yes, we do. Thanks, Phemelo.
All right, thank you. So I'll be presenting about the spatial validation project that we did alongside the GCRO and the Gauteng Office of the Premier. And this project basically uses the application of satellite imagery and monitoring the construction of healthcare facilities within the Gauteng province. I'm going to skip this slide. I know you did such a great work at introducing me. But just to give you an overall background with why machine learning or why remote sensing, my master's was specifically in assessing and comparing the performance of various machine learning models within water quality studies. And I remember when I started this dissertation, I was given this data set and I was overwhelmed. I will not lie to you, I was overwhelmed. And then when working with it, I started to realize that I'm seeing errors. And you know what they say with machine learning models, what you train it with is what you will get. So rubbish in, rubbish out theory. That's when I decided to reframe my master's dissertation a little bit. And I baselined this with a very well-known theory within machine learning, which is called the no free lunch theorem by David Wolper. And this theorem basically says that no algorithm is sufficient across all data sets. So this kept me thinking, and that's what resulted in me working on my master's dissertation to see how sometimes as much as machine learning and AI is so great, it sometimes is susceptible to errors. And yeah, that was basically my master's dissertation. And those are some of the projects that I've worked with. I've been very lucky to work with various entities from the Gauteng Office of the Premier to the National Institution of Communicable Disease, Gauteng City-Region Observatory, and currently where I am, which is the Center of Emerging Researchers. So about the project itself. Before I bore you with the aim and objective, I would actually like this to be a bit more visual. So just keep in mind that what we are doing is that we are looking at a data set that is provided by the Gauteng Office of the Premier. And this data set is about infrastructure expenditure. So just bear that in mind. And then bear the fact that we want to use satellite images. So I know one could be like, oh, but Phemelo, how do we join these two things together? How do we take satellite imagery and what does it have to do with government procurement and expenditure? So sometime in 2023, the Gauteng City region had a meeting with the Office of the Premier, and this was specifically for the Inclusive Economies team, where they requested expenditure data from the Office of the Premier. And I remember sitting there, not really knowing much about procurement, not knowing much about policy making, and just being so dumbfounded as to what everybody's talking about. I was shocked. I then went back, did not look at this data set because I chose peace, but it kept bothering me as to, but why do I not understand that data set? What is it? What are they trying to say? As much as, yes, this IRMV5 report, what it is, it's that it's the infrastructure reporting model. So this is what the Gauteng Office of the Premier uses to track infrastructure projects across different departments, from health to education, road and transport, even human settlement. And it's a consolidated report where they are able to pinpoint how much they've spent on a certain project, where it is, and how long it took. Now, as great as that sounded, the data set did not make sense to me. And as someone who's, as mentioned earlier, I am more of a technical person than I am with regards to policy making and procurement. I had to sit down with that data set and say, how can I make it make sense to me? So now you're taking a little deep dive into the mind of someone who's more analytical than they are. So looking at this data set, I decided to break it up for myself. Now, number one, I know that the data set is a reporting model, so check. But then what is the data telling me? The data is telling me about, firstly, construction projects. So I have the project name. Most importantly, I have the project location. Then to add the cherry on top, I have when the project started, when the project ended, as well as which stage of construction these projects are. Now, the total expenditure was more of other people's cherry on top, but from a spatial person, this is all I needed. So I decided, hey man, why am I trying to understand policy? Why am I trying to understand the fundamentals of procurement? Why do I not have a home ground advantage? And that's when I decided, let me validate this. I then decided to go on on a deep dive on the internet, looking at these healthcare facilities. And I looked at media reports of people talking about the state of these healthcare infrastructures. Shockingly, some media reports talked about the non-existence of these healthcare facilities, which made me question, how true is this report that I'm looking at? So the report itself, I then decided to start cleaning it in a way that made sense to me. So remember, we're still working with projects from the Gauteng Department of Health. And then I noticed that, oh, these projects actually are funded by two main sources. One, which is equitable share. As we can see that from the Department of Health, there was 182 projects. Now, these 182 projects are unfortunately only electronic maintenance projects. So satellite imagery will not serve its purpose for this. But luckily, I also started to see that, wait, there's a second grant, and that grant was the Health Facility Revitalization Grant. Now, this grant spoke to the construction, maintenance, and upgrade of healthcare facilities. I then decided to divide it according to the nature of investment so that I can understand better the flow of money or the usage of the money that was being used for these projects. We then further decided to divide them according to new and replaced structures. So this can mean a totally new healthcare facilities, or it can also mean that a healthcare facility that was maybe extended. It was also divided according to maintenance and repair, which for the sake of this webinar, we did not look at because yet again, satellite imagery can only do as much. So with regards to maintenance, unless it is maybe it is paving, that's where satellite imagery could have been useful, or unless it is some roofing maintenance, that's where satellite imagery could be useful. But if it's internal maintenance, unfortunately, it did not serve. So we did not really look at this as much. So, and then it was also divided according to upgrades and addition. So for this presentation, I will just be specifically looking at new constructed healthcare facilities. So earlier on, I mentioned that there was two sources of funding, which was the equitable share and the healthcare facility grant. Now, in order for me to understand, I guess, and just draw this overall picture in my head, I needed to understand what the grant was for. Now, as we see that this grant, firstly, was to enhance the quality and quantity of the state of healthcare infrastructures, but it's also for the development and construction of new healthcare facilities. Now, if you go about yourself and you read more about this grant, you'll find out that they do have goals in which way these healthcare facilities should be. And most of them align within the TISH mandate. And for those who do not know what TISH is, it is the Township Informal Settlement, Informal Township, um, Informal Settlement, squatter camps. Yes, basically informal areas. Sorry, I'm fighting my words there for a second. And yeah, so that's where these healthcare facilities should be. But then I would like to draw your attention to one key responsibility. And that key responsibility is that whoever is contracted for these healthcare facilities is mandated to attend a quarterly infrastructure project review. So in my head, I'm already thinking that, oh, this reporting model that I'm looking at should be up to date with the latest meeting to talk about if the healthcare facility has been constructed and where it's at in its construction phase. So, yet again, trying to draw this picture of what exactly I'm looking at, I decided to look at it spatially within the context of the broader thing. And looking at these individual new and constructed healthcare facilities, started to see a pattern. I saw that the initial plan is that these healthcare facilities need to be within highly population dense areas, but also they are within areas of high social economic status, but they are also within the outskirts. So now I'm starting to draw this picture, but now this picture still needs to make more spatial sense to me. Then I decided to use other data sets, such as get a better understanding, because the grant itself is mandated to follow the TISH mandate, which is that it's supposed to be within township, hostels, and informal settlements. How close is these newly constructed facilities to that mandate? And honestly, it was achieved, as we can see that 90% of healthcare services were within informal areas. We also noticed that 48% of these healthcare facilities was distributed between declared and undeclared townships. We also saw that when it got to the age of informal settlement, they were not biased when choosing the location of which these healthcare facilities should be. So we can see that it's equally distributed from the oldest informal settlement to the most recent, which is 10 years. We also decided to look at it from an area of need, doing population density calculations, and we realized that 11 of these healthcare facilities are within low dense areas, but also 8 of them are within extremely high population dense areas. So for those who don't know, the Gauteng City region does have what we call the quality of life survey. So this quality of life survey is basically the overall human satisfaction, and it looks at indicators such as access to healthcare, satisfaction with health as an overall, government satisfaction, and it's a lovely index. We also use this index to see where these healthcare facilities are. What is the overall assumption of people's livelihood within that area? And we saw that the Gauteng, well, this is using the quality of life, the sixth iteration, which was 2021. We saw that 63% of individuals actually falls below the provincial before the provincial line. So they were able to target areas where there is a need. However, targeting these areas didn't necessarily speak to what is on ground. So from a spatial perspective, from a mapping perspective, even from a reporting perspective, we tick all the boxes. Yes, these healthcare facilities are where they're supposed to be. They are serving who they're supposed to serve, but do these healthcare facilities actually exist? Now, going back to that big table that I showed you in the beginning, we decided to now reclassify it according to their construction stages. Now, the report itself gives us a column which is called the IDMS gate. So this column basically tells us the stage in which the phase of construction is in. From stage 1 till stage 4, it is the feasibility stage and documentation. Then we have stage 5, which is the actual work on site. So my keen interest was from stage 5 till the handover, which is stage 7. And we started actually seeing patterns. And I would like to emphasize that the data was not manipulated nor edited in any way. So when categorizing this, we started to see that, oh, we have a project that the closing date is said to be on the 31st of March, yet it's still in its feasibility stage in 2023. That flagged as a problem. We also started to see this pattern actually occurring. And then when we actually looked at stage 5, which is actual work on site, we saw that only 5 projects is there active construction happening, and no project has been closed out as yet. So this became a problem because we have this reporting model. It's telling us the yearly amounts of money that are spent to date, but the reporting system, when filtered, looks like this. So this started to become a problem, and this is where the need to say, hey, what's going on field, on site? So that's where the concept of using satellite imagery came about. So why satellite imagery? Just to browse through this, we are dealing with infrastructure, meaning that we are dealing with something that is a land use that takes up space on Earth. And for the fact that it's a land use and it takes up space, we can see it using satellite imagery. So then it came to mind that, hey, yet again, I'm keeping to the theme of my comfort zone. How can I then prove that, wait a minute, this healthcare facility, you're right, it does exist, but no, this one doesn't exist. And that's where we start using remote sensing. Now, just for a brief overview with what remote sensing is, or some people call it Earth observation, this is just basically viewing the Earth from a satellite imagery, which is usually above cloud level. And we can see it through different spatial extents from 1 kilometer to the highest of spatial resolutions of 1 meter. Now, historically, there has been satellite images. So if you're looking at a certain year, it will have to correspond with a certain satellite that was released within that time period. So as we can see that we have satellite images such as Landsat 1 and 5, which was released between the years of 1970 to 1980. So if you want to get images as far back as that, you can. The only disadvantage is that the spatial resolution is between 60 to 80 meters. Now, usually at this resolution, you will not be able to see the exact healthcare facility because the spatial extent is too large. But that is not a problem. Recently, we started using satellite images such as Landsat 8, Sentinel-2. And with these satellite images, they have a spatial resolution between 10 meters to 30 meters. Yet again, enabling us to view what is on Earth from a spatial perspective. But now within the era of 2010 and 2020, we started getting even way better spatial resolutions through satellites such as Worldview, even through drone imagery. So we're then able to better understand what is going on the surface of the Earth. And because we are able to date it back, that time series analysis to see from this time period to this time period, how has that land cover or how has that area changed over time became more and more easier. I'm just going to glide through this. So now, what is the overall goal that we're trying to do? As we know that the Earth's surface is more dynamic than we think. It's not just made out of buildings. There's agriculture, there's water bodies. So how do we then separate this broad land cover and our only main focus being the building, but also being able to look at that building over time? So this is then the aim of the project. Okay, so for this project, we decided to look at the machine learning algorithm, which is known as support vector machine. This is a classification algorithm that we used in this model, and it was trained, basically just to simplify, it was trained to be able to detect the difference between a building and a non-building. So we did not care to classify if it's a water body, if it's vegetation, if it's land. What we wanted to do is, am I a building? If not, it becomes non-building or unclassified. So we only want to be able to extract. So that's the model that we did. And this was trained on Google Earth Pro, which I am more than welcome to share with you. But after that, so feel free. Yeah, so just to give you a brief overview of trying to explain the coding behind this, I guess. What we used is that because we're looking at buildings and buildings are dynamic throughout, we have different shapes, different heights, and whatnot. To make our lives easier, we decided to use the Esri building footprint shaper. So this is dynamic enough because it looked at building heights, building shapes, building lengths, and it was able to help us train a model to say that on this land cover, if you detect this, classify it as a building. If not, unclassified, it's not our business, we do not care. The satellite images that were used specifically for this project are found on the Google Earth archives. And the two main satellite that we used was the Maxima technology as well as the Airbus images. So the reason we use this is because their resolution is 30 centimeters. So if you look at a ruler, you know that a ruler is 30 centimeters. Now imagine being able to see that greater quality from a spatial perspective. I'm sure you can already do a lot. I mean, you can even spy on your neighbor if you want to. I digress. But that's how great of a spatial resolution these satellite images provided us. So this is just a schematic diagram of basically how the model trained to try and explain it as better as possible. So we then use this Esri building base footprint. And what we did is that on Google Earth Engine, we located our area of interest. Now, if you remember earlier, I did say that the reporting system did give us the exact coordinates of where the healthcare facility is supposed to be. So we use that exact coordinate to build what is known as a ROI or region of interest. And that is where our model will be able to look at using the start date as an initial layer and the end date as a final layer and detect land cover changes over the years. So an example here is with Green Parks Clinic. And according to the reporting system, Green Parks Clinic was construction started in 2015 and it ended in 2023. So already in our minds, we knew that before 2015, there should be nothing there. It should be either vegetation only or it should be a bare ground. So we then trained the model to say, track all the land cover changes that you see between this time period. So from 2015 to 2023. And as you can see, in 2015, we can see that there was a few buildings here, but there was nothing here. And then at the end of 2023, the model was able to pick up on buildings here. And then we now further validated this with actual images that we found on Google Earth historical images. And we could see that the model was validated because in 2015 May, there was absolutely nothing. And in 2023, there was something. Now, you could ask yourself, but Phemelo, can't I just go through all these images year by year? You can, but just know that you'll be looking at monthly images for every year for about 10 to 15 years. That is exhausting. So that's where the machine learning part of it comes, where we automate this model enough to say that you train, you pick up if there's a buildup or not. And then you give me the final results. And the only thing we do is change the region of interest or change the exact location that the report provides for us. Now, this is one of the cases where we can take that based on the set constructed healthcare facilities. This healthcare facility, which is Green Parks Clinic, was actually constructed. Then we just to kind of show you basically how the model filtered over time. As you can see there that looking at the project started in, as I said, April 2015, we can see that work on site only started in 2017. Now, I want you to bear this in mind towards the end, and then we can see that construction actually finished in 2022, though it was recorded that it was finished in 2023. So these are now some of the anomalies we started picking up to say that, wait, this reporting system might not be as up to date as we'd want it to be. Remember, earlier I did say that the reporting system did have what we call IDMS gates, and it classified the stages of construction. And we started to realize that this might not actually be the case because between 2015 and May 2017, stage 1 and stage 4 occurred, which is the suitability analysis and the documentation. But actual site works, which is stage 5, only started in June of 2017. And then we can also pick up on another anomaly that the project ended in 2022, whereas according to the reporting system, it is noted that it ended in 2023, and there's also expenditure set for that year. But then again, that could just mean that the internal facility of the structure itself, that's where the 2023 expenditure went to. So that would obviously be then further validated with maybe an actual site visit, or can be validated with invoices. But what this showed is that the satellite image was able to see if there was a mixed match between when the project actually started and when physically, from a spatial perspective, when it ended. Another example is with this healthcare facilities. But now, remember, as I said, that some healthcare facilities, we see that there's a certain amount of expenditure that is said to be spent on this project. But when looking at it using satellite images, we can see that during the 2019 COVID pandemic, between the years 2022 and 2021, this healthcare facility was actually abandoned, right? And then we went further and said, hey, maybe it's a positional inaccuracy because those do occur. Let's check. And we actually noted that the initial healthcare facility, yes, was supposed to be constructed here, or rather there's workings that there was supposed to be some form of construction there, but nothing ever happened till date. This is how the site looks like. And yet again, the model was unable to pick up on anything. The only thing the model was able to pick up on was the surrounding infrastructures or surrounding houses. So then going back to the positional accuracy, we then decided to say, hey, we can't just rely on the model and satellite imagery. Let's also do Google searches. Let's see if we plug in the name of this healthcare facility, which coordinate will it give us? In this case, we saw that the recorded coordinate on the report is a totally different location than where the actual healthcare facility is. But furthermore, we also saw that, yes, if we look at here in 2012, this is where the actual healthcare facility is, in 2012, when the project was set to begin. And then we see immediately the following year, which is April 2013, there's already these immense structures around it. Now, learning from how previous construction projects has worked, it was somewhat impossible to say that so much construction had already taken place. So this is when the site visit also took place, and we then were able to see that these aren't actually constructed facilities, but these are mobile facilities. And yet those are things that is not recorded within the reporting system alone. The reporting system just says construction of a new healthcare facility. It does not say um, mobile facilities were used. So that's yet again another anomaly that we started picking up with the reporting system and validating it. Now, with my previous presentation, I think it was in September, one of the questions that I got from the audience was, but Pamela, if I can't code or I can't have access to these old imageries, what do I do if I want to validate a healthcare facilities within a certain time period? Now, the Department of Forestry, Fishery and Environment does have a data set, which is the land use land cover classification, and they basically use the same algorithm as I did. The only problem is with their one, they are looking at a more lower resolution imagery than I am, meaning that, let me just show a brief example. In my case, the model was able to somewhat pick up on the exact structure and kind of see the following the exact structures pattern using the Esri building footprint. Whereas with this one, all it does was it classified the changes in land cover. So as we see with this model, we can see that yes, there was a change between this area used to be grassland and now we changed to a build-up area, or it used to be barren and now it has changed to build up area. So that is, I guess, another option for people who are maybe not that keen in wanting to train their own models. However, I would like to emphasize that because of the spatial resolution of this data set, you will not get as fine results. But yet again, we validated the department's classification and we saw that yes, indeed, it was correct. In 2015, when this facility was said to be constructed, there was nothing there. And currently now in December 2023, there is a healthcare facility. We then also further validated it to understand when exactly did construction start. And as we can see that the project on the reporting system was said to have started in 2015, where actual work on site, which is yet again stage 5, only started in 2018. So now we have this period between 2015 and 2018, which was set to documentation. Then construction only took place between 2018 and 2023. But yet again, what did the reporting model was able to show that every year since 2015, a certain amount of money was spent for construction. So yet again, this might be a possible anomaly, or it can go through contracting, but those are not what we can speak to. We can just speak to what's happening on the ground. Another example using the Department of Forestry and Fisheries land cover, we were able to pick up that there is a healthcare facility known as Lehae, or in Setswana would say Lehae. So this community healthcare center was supposed to be constructed at this very specific area, but we saw that nothing was ever done, no preparation, unlike the other one, no preparation was ever even done on site. However, this is a project that is recorded, and this is a project that is said to have closed on the 28th of February 2024. We also then took a deep dive on the internet looking for the high community healthcare centers, and unfortunately, we were not able to pick up on that healthcare facility, though it's still stuff that we need to validate. And even if you had to go to the site and follow the exact coordinate given, this is what you would currently find there. So the overall findings, looking at those 18 healthcare facilities that are reported to have been constructed, we can see that only 8 of them were actually new healthcare facilities that were actually completed. And apologies, I had to filter out the name because this is still an ongoing project and we don't want to disclose too much. But another sad finding is that from the model itself, we also started to pick up that 7 of the healthcare facilities that are said to be new and constructed are already existing structures that were not extended, maybe with another room or another facility. None of those changes happened. So we have a case where money was spent, but the structure remained the same. There's no physical change that we can see. And for those who would be like, but what if this was maintenance? Then it goes back to an anomaly with the categorization in the model itself. Then it should have been categorized as maintenance or renovation, but rather looking at the name and the way they classified it to us, we will take it as it is, and we will take it as it was supposed to be a newly constructed healthcare facility and nothing was ever constructed. Then we see that 3 of these do not exist at all. One, it is a mobile facility that was added, but when we look at the expenditure of that mobile facility, it's a bit high. Then 2 of these projects, as I mentioned, this a site was abandoned and another one, nothing ever happened on the actual site itself. So what are the key findings? The key findings is that with regards to construction and infrastructure, if it's geolocated, we can monitor it, we can assess it, we can check if it exists. We can even go back and see when, by the time it is said to have started, if it does and if it does not. I mentioned earlier on that if you are a brave enough person and you want to look at images, monthly images year for every year, you can, but we also know that machine learning algorithms in this case to classify did kind of speed up the process to be able to detect these anomalies very quickly, detect where there isn't an infrastructure, or in places where there was an infrastructure that already existed, the model was able to detect if there's any changes, be it a certain room was extended or the facility was extended. So those are the things that the model was able to pick up. Another thing that the key findings of the study was that high resolution satellite imagery is robust enough to validate government infrastructure. And unfortunately, in South Africa, we do struggle with high-res imagery, but I believe in sensor, so I will have faith with regard to sourcing these satellite images. But yeah, and just the integration of procurement and expenditure as well as satellite, remote sensing is possible because we are able to validate the spending. Is it there? Is it not there? When did it start? But why was it recorded that it started this year when it didn't? Where did the money of this period then go to? So those are the questions we are able to ask ourselves. Then with the reporting model itself, we have seen that unfortunately it is not necessarily the best way in which infrastructure can be reported. We saw that it misrepresents what's actually on field. We saw that it does not categorize the project according to its date, so it is not constantly updated. And then to some extent, it goes against the nature of the funding itself. If you recall, the healthcare facility revitalization grant did mandate that there should be quarterly reports on the progress of these infrastructures. So the model does not capture that information very well. But also one thing we noticed about the model itself was that when we're looking at expenditure over the years, it did not accumulate to the total amount spent on that project to date. So that's a little bit of anomalies that we also detected. And the step forward would now be okay, because we know that satellite imagery was able to validate the existence of these healthcare facilities, tell us when we constructed and so forth. What is the next step? The next step is to remodel the IRM model itself, taking into account all this information that satellite images was able to provide us. And this is still a continuous project with the organizations. So hopefully sometime soon, I will then come present to you the actual reporting model or the reworked reporting model that will, I guess, help with the few anomalies that we picked up during the study, from positional errors to project actual start dates to how long it took for feasibility studies to be done. And in cases whereby work was done but the site was abandoned, we can then get further information that, oh, maybe when they did the feasibility studies, they noted that according to some data set that we use, the area itself was a wetland, so it's not a viable area to build. But unfortunately, that's not what the model tells us. So the model still records that area as a completed area. So yes, thank you very much for your time. And yes, if there's any questions.
Thank you so much, Phemelo, for such an insightful presentation. You have actually gave us a fascinating look into the power of remote sensing technology, which could be very helpful in actually monitoring how we spend as government in infrastructure projects, especially in the health facility.
Yes, and I would also just like to add one question that I actually got last time during the public economics conference was people was asking, is this model only applicable to healthcare facilities? No, we can look at it from such as RDP projects with human settlement. We can look at it between the construction of roads with road and transport. So the data they gave us is broad. So yeah, for this presentation, or for the sake of this presentation, we only decided to look at one part of it because that's what we were requested to do quicker, but more work can be done on that. And the model is vast enough to be able to pick up, as long as we have the location, as long as we have the date that we can use to do our time series analysis, it is possible.
Uh, Thank you, Phemelo. I think we've got a hand from Tsokofatso.
Okay.
Thank you, Phemelo, for a very insightful presentation. I don't know if I'm audible enough.
You able to hear me?
Not very clear. I'm sorry. I don't know if it's on my side, but I'm not hearing you well.
Can you hear me now?
Yes, yes.
Okay, I have a comment
Okay.
and a couple of questions. Um, just to come back to that whole issue of um construction starting and only starting to detect it on satellite imagery a year or two after the actual start date. You need to you need to separate or know when bulk infrastructure was deployed on site. When you talk about bulk, we're talking about all the pipes, all the electricity that's required. It's normally done first before you do the top structures, and the top structures are the stuff you are able to pick up using satellite imagery. So just go back and think about that a bit. The other one relates to where did you run your model? Did you have the data downloaded, or was it run through Google Earth Engine?
So we actually we were able to, some of the sites we were able to get the exact satellite images, and we were able to do the classification with R, but some we did with Google Earth Engine. It's still the same code. It's just that based on the satellite images that we could. So for example, with the ones that were were classified more fine, I would say. That's the ones that we did with joining both R and Google Earth Engine. Yes.
And the last two, why did you use SVM instead of other more sophisticated models? And the last one is, have you considered using synthetic aperture radar data to actually account for building height? as part of the change detection in terms of construction?
Okay, thank you very much for that. So just to answer you with why SVM, I will not lie and say we've played around with vast models. We only looked at two classification models, which was the random forest classifier and the support vector machine. And from the two, the one that yielded somewhat of the best results was SVM. That's why we decided to go with it. And we were also at a time crunch. So unfortunately, I was not able to explore other models, but I do think that that's not necessarily a limitation. That is something that can still be done. And if the models that you did advise does maybe yield a higher overall accuracy, it can be considered. But then remember that at the end of the day, yes, different models do have certain accuracies when it comes to classification. But at the end of the day, we are looking at land cover changes over time. So yes, a model can be able to maybe detect the shape of this house much better. But at the end of the day, if the imagery that we have is not high enough, or there is no land cover change actually that's taking place, then the model doesn't really play much effect in that instance. So using other models will just be in a case where I would want to compare accuracies. But because this project is not necessarily comparing how accurate certain models can classify, but rather looking at the active changes, we just decided to keep it at one, which is support vector machine. And then your other questions was looking at other data sets. Definitely, it is something that we will take into account. I did say that this project is still continuous. So if you wouldn't mind, I would love to get your contact details and just get a better understanding of the model that you spoke about and see how we can apply it to this project. Thank you. Hello?
Thanks, Phemelo, and thanks, Tshegofatso. Are there any other questions for Phemelo or comments that you have? It seems like there are no questions on the chat as well. There are no hands being raised, Phemelo. But I would like to remind everybody you can find this presentation on our Knowledge Hub as well as the YouTube channel. It will be posted there. And I would also like to remind everyone to please engage with us and give us feedback. How was the session on our survey? Without any questions or comments, I don't know whether we can close the session. And thank you again, Phemelo, for such an insightful presentation.
Thank you very much. And thank you to everybody who participated. And I'm sorry, I forgot the name, but the gentleman who provided
Yes, Tshegofatso.
who provided feedback. Thank you very much. And as what you said, that I did say that we cannot speak to why maybe the projects took so long, but that was such a valuable thing to go back and say that, hey, sometimes we might look at the physical structure of it all, but there's actually processes that goes in, as well as I said, site suitability. So in our reporting, those are definitely pointers that we will jot down. So thank you very much for that comment. I truly appreciate it.
Thank you, colleagues, and have a very good weekend and Friday.
Thank you.
Thanks.
Thank you.
Thank you.
Bye.
Thank you. Bye-bye.
Thank you. Goodbye.
Bye.